I'm doing biology and that for O-level. Don't like it, but Mum says I need it for being a doctor. Don't want to be a doctor. I want to be a soldier.
Bloods, drugs charts, first dose IVs, Venflon. Mr. Edwards has spiked a temperature again.
Who bloody Ray? £2 an hour I get for this. Compared to me, the geezer who's teasing body bits out the drain under the morgue is pampered. I can think of no more miserable way to spend a Saturday afternoon than to be second on house officer for crap like this, stuck in this festering cackhole of a hospital with not one single thing to endear it but the breathe in, peekaboo, and out. I can't find anything which might explain your temperature, but I think we should do some more tests of your blood and urine just to be on the safe side. I'd never forgive myself if I overlooked a simple problem we could treat. Can't I be doing yourself a mischief, Arthur?
But my name's not Arthur.
This one's for me. Something to stop vomiting.
I have an urgent bleep message. Babe alert. Lecter ward. Babe alert. Lecter ward.
Claire's still up to her neck in that DKA, so maybe you could see this next one we've had in. 59-year-old man, recently widowed, dithiopin overdose during the night. Will you be washing him out?
Not if the OD was last night.
Well, Claire might insist on washing him out anyway. Make him think twice before taking another one.
The last thing this man needs is to be punished for what he's done.
Excuse me?
I thought you'd be busy down here, so I'll pick you some sandwiches up before the canteen shut.
Thanks very much.
Would you lavage someone who OD'd last night?
No, but you can't always rely on an uncorroborated history from someone who's just tried to top himself.
Well, you can make any excuse if you resent ODs enough.
Even contempt counts as emotional involvement. Not my style.
Dr. Maitland, can I ask you not to eat in the department, please?
Unlike you, Charge Nurse Sutton, I don't get protected breaks and meal times. In an environment in which I can work a couple of days without even a sit-down, I'll eat where and when I please. Oh, yeah, that LVF we were expecting died in the ambulance. So that's one less admission to Clark.
So what about this overdose, then?
No washout.
Present the case, Dr. Roger.
Clinical inspection revealed little apart from her chronic pulchritude. I then called upon the most searching instrument of investigation known to medical science. I asked Ward's sister to check her out.
Excellent.
She is Miss Judith Edwards, age 23, legal secretary, self-referral to the ward, visiting her father, Mr. Ronald Edwards.
Well, whatever her dad's got, he's bound to get better. Nothing guarantees round-the-clock medical attention like having a gorgeous daughter. Ah.
Collin Premiership. Arsenal 0, Manchester City 0. Chelsea 1, Norwich City 2. Country City 1.
Oh, United went down again.
I don't really follow football, Mr. Blewett.
No, I don't suppose you would.
Cardiac arrest. Caroline. Mr. Blewett, cardiac arrest.
Can you...
What the bloody hell are you gawping at?
Mr. Blewett has these funny turns sometimes.
Petit mal epilepsy.
Well, come on, sunshine. Patience to see, lives to save.
Bye for now.
It's the first we've seen of them two all day. No doubt they've been in the doctor's mess drinking rivers of tea.
At least that false alarm brought a bit of glamour to the ward.
I really don't know what men see in Claire Maitland.
No, Andrew.
He's not exactly a pump-action, six-gun lover.
Do tell.
He's normally too tired to be decent company. If he worked all the time he claims to, he'd be doing 100 hours a week.
He does, doesn't he?
Hello there, this is Staff Nurse McDougall on Lecter Ward. The RSO's accepted a patient of ours for transfer to you, a Mr. Hector Gonzalez, aged 107. He's alcoholic, senile, incontinent in both urine and feces, and his bed sores are infested with maggots. If you do manage to catch any of his diarrhea, it needs sending off for culture. I've written up Mr. Martin's treatment for his Peyronie's disease. Sister Jackie took the call from the GP. Trevor, I've told Nurse Whitecoat that the old sewer, Mr. Martin, has Peyronie's disease. And at this very moment, she's applying ointment to the affected part of his anatomy. Doesn't that affect your... Willie, yes.
The medical officer's given steroids, but the patient's still very wheezy.
Right. No chance of you being on steroids after your slug-like approach to that crash call?
The only thing to which an on-call doctor should respond instantly is the opportunity to sleep.
The caring doctor learns as much from listening to their patients' troubles as from listening to their heart.
Didn't Dr. Hilary Jones say that last week?
My mum says I look like him.
I think he's disgusting.
Girl's name, too. Were there these little marks on your fingernails yesterday?
Not sure.
I completely forgot to ask you. How'd you do in your exam?
I failed. Let's hear about Mr. Edwards.
He has a prosthetic heart valve and he's had low-grade pyrexia and malaise on and off for a week. Now he has splinter hemorrhages and I think his murmur is louder.
2 blood cultures this week have shown no growth. If you're worried, repeat them.
Don't you think there's still a fair chance he's got endocarditis?
Dying for a shower. Could you take the RSO bleep for half an hour, please?
Hello, Dr. Raja. Oh. Hello, Mum.
Are you busy?
I am, actually.
You're eating properly, I hope.
Of course I'm eating properly. I know hospital food isn't...
Bring you something in at lunchtime.
No, don't bring me anything in at lunchtime.
Oh, am I embarrassing?
Of course you don't embarrass me.
When are you coming home?
Next weekend?
Oh, I look forward to it.
Okay.
You can meet Mira.
No, I don't want to meet her.
But why not?
Because her dad's a gangster, that's why.
I know you're busy, and I know you don't like me coming into your work, but I'm afraid I care about you. I can't just stand back and watch you falling apart.
Peter, I failed. For the past 4 months, I've spent every spare minute studying. Working 90 hours a week, running a home and raising 2 children.